sulfonamides, commonly referred to as sulfa drugs, these are actually a very early type of antibiotic that were actually put out even before penicillins. They're not as effective as penicillins are, though, in fighting infections, so they're seldomly used. They're not used a whole lot. They are still occasionally used for certain types of infections. They're very good for urinary tract infections, and for certain, they can be used to treat certain strands of MRSA. Their mechanism of action, they're a bacteriostatic type of antibiotic, and the way they work is by inhibiting the folic acid synthesis of the bacteria. One of the reasons why they're also not commonly used a whole lot is that one of their common adverse reactions, and we're going to talk about the adverse reactions in a little bit of kind of antibiotics in general and single some out, but one of the things with sulfa drugs, hypersensitivity reactions, or people being allergic to sulfa drugs is a very common thing to see. So looking at routes of administration, obviously there's oral antibiotics taken through the use of pills. The key there, as we talked about, make sure you take the entire course. Again, people, usually within 24, 48 hours, if they have an infection of some sort, people typically start to feel pretty good once they start taking the antibiotic. So it's important, though, that the patients be compliant, they take the full course, because the infection will come back if they don't do that. There are topical versions. We see this very commonly with antibiotics used to treat superficial wounds, so that those are available, and many of those are available over the counter. And then you have IV administration, allows for a very high concentration of the drugs in the bloodstream. It also is good for patients who are unable to do oral drugs. Sometimes these will have to be done for longer periods of time, particularly for bone and joint infections. And then there's also intramuscular injection of antibiotics. One thing associated with the intramuscular injection is they can eliminate the infection faster than oral antibiotics. They get absorbed very quickly because of the blood supply to the muscles. So, and just review, see some text examples just to kind of familiarize yourself with some of the different names of your antibiotics. So again, review that table 9.1 on page 124 in your textbook, and again, as always, you should be reviewing the reading to complement what we're talking about here. For side effects, what we're going to do is we're going to kind of look at just the side effects in total, I guess, for all of them, and maybe just point out if there's some specific side effects that are more commonly associated with certain types of antibiotics. I'll point that out for you to know. They all have nausea, vomiting, and diarrhea, so they all produce issues with the gastrointestinal tract. Part of this has to do with, again, the issues associated with disturbing the kind of natural good bacteria that are in the gastrointestinal tract. And there's one particular infection that could occur, Clostridium Difficile, or what's known as C. diff, and we'll talk about that in a little bit. That's a little bit more of a serious infection that requires some further treatment to kind of deal with. But you can just get even just some regular, more or less benign diarrhea associated with taking antibiotics. With penicillin, you have to be concerned about allergic reactions. It's not uncommon for people to develop reactions to penicillin, and the reactions range from a mild rash to complete total anaphylaxis, just as any other allergic reaction. What they typically say, if a person in the past only developed a rash, the penicillin could be replaced with a cephalosporin. If anaphylaxis occurs, they do not want you to use the cephalosporin. Remember, we talked about how the structure of cephalosporins are very similar. So depending upon what type of allergic reaction they've had in the past will dictate whether a cephalosporin is appropriate or not. sulfa can cause, we talked about Stevens-Johnson syndrome before, which is a fatal cutaneous reaction. So if someone is taking a sulfa drug, and I don't believe, just from my own personal experience, that sulfa drugs get prescribed a whole lot anymore. But if a rash, again, would develop in the instance of using a sulfa drug, make sure that a physician gets contacted. Aminoglycosides have the side effect of hearing loss, commonly associated. Tetracyclines, and you see this a lot in people who are taking tetracycline antibiotics for acne, very sensitive to sunlight. So these people should not, if you're taking a tetracycline antibiotic, you should be avoiding sunlight as much as possible. Fluoroquinolones, we talked about the tendency for tendon ruptures, so that's something to be mindful of, particularly in your active population. So we talked about the interference with the beneficial bacteria, and this is one of the main things that you commonly see. And again, it doesn't always necessitate that it's a major issue, but it's just something to be aware of. And again, you can get diarrhea. Antibiotic can sometimes cause yeast infections as well because of the disturbance in the good bacteria. And the most severe form of diarrhea, again, is the Clostridium Difficile, or again what they commonly refer to as C. diff. And what happens basically is the beneficial bacteria get destroyed, and that particular type becomes dominant in the gastrointestinal tract and produces severe diarrhea, and that will require you need specific treatment for that. Interestingly enough, it's still treated with an antibiotic in a lot of instances, so it's kind of ironic that you treat a antibiotic-induced infection with an antibiotic, but that's how they usually treat it. And again, review that table. I think I've made mention of this table a couple times just to give yourself some idea and familiarize yourself with the names and some of the specifics about some of the different types of antibiotics. So just to kind of summarize the adverse effects, again, note the common ones that I discussed with some of their particulars. For instance, like with the fluoroquinolones, note the tendency for tendon ruptures. There's also, which wasn't mentioned, potential to interfere with birth control. So if a woman is on birth control, she should be made aware of the fact that taking certain antibiotics will do that. And again, the destruction of helpful bacteria, which again is another reason why if an antibiotic doesn't need to be prescribed, it shouldn't be prescribed. And again, that's up to the physician. But you really have to watch, because people are very into taking antibiotics because they think it makes them better from everything. And again, they're not effective for viral infections. Even sinus infections, interestingly enough, everybody runs to the doctor right away wanting an antibiotic for sinus infections. They've looked at this a lot, and a lot of your sinus infections even are more perpetrated by viruses. So again, we have to get over the overuse. It's not to say that antibiotics aren't helpful and aren't needed, but again, they should really only be used when necessary. And again, the broad spectrum antibiotics are going to be more prone to causing these adverse effects because of the fact they kill such a wide range of bacteria. So to talk about topical antibiotics, and a lot of your topical antibiotics, that you could purchase topical antibiotics over the counter in many different forms. There's probably some version of it in the athletic training room right now. They're used on the skin and eyes. They basically work through the same mechanisms. Your common is a triple antibiotic, which you'll see a lot of times. A lot of people use these on wounds, and what the triple antibiotic is, it's a combination product of some different antibiotics. So we're going to talk about these a little bit more later on, and some of the ways that they get utilized. So for general use, again, antibiotics only effective for bacterial infections. And again, take the full dose. Don't stop taking them once you feel better. You have to make sure that you complete the entire course of the antibiotic to make sure that the bacteria has been completely eradicated. Okay, so if it's a 10-day course, a 7-day course, it has to be taken completely. Again, people typically will start to feel better a day or two into taking it, and there's the temptation by a lot of individuals to stop taking medicine at that time. They need to make sure that they take the complete dose. Alright, so moving on to antifungal agents. So fungal infections, many fungal infections are actually opportunistic infections. So basically what that looks at is, there's certain conditions needed for them to occur. In other words, many fungal infections will occur because the immune system is suppressed, either due to another health condition, or in some instances actually because of medications that people are taking. For instance, corticosteroids have a tendency to suppress the immune system, so sometimes that could put people at risk for getting different types of fungal infections. So that's something to note. A lot of times in the sports medicine realm, what we're going to be dealing with are skin infections or the tinea infections. You can also it's important to note that fungal infections could also be systemic, and they could come in the form, for instance, you could get for instance, fungal lung infections, which can happen as well. So the antifungal agents can be applied topically, which again we commonly associate it with our skin infections, or you can have oral forms of antifungal agents as well. Here's a little discussion post I'm putting up. I want to see how you guys look at this. Look at the picture in the slide here. What is that pathology? Remember, we're talking about fungal infections. If you look inside the mouth there, you can see defined white patches on the tongue. What is that pathology? And again, answer that on the discussion post. So your antifungal medications, we talked about oral. There are also intravenous versions of antifungal medications. Most of the fungal infections that, again, we'll commonly encounter as athletic trainers will be topical. Again, you need to, obviously, your general medical conditions, competencies, you have to be able to recognize if the case there's the potential for a systemic fungal infection. You may have certain types of situations where your oral antifungal meds may be more effective. For instance, if there's multiple lesions on the skin, issues with the scalp, and particularly the nails. Now, they actually did, or at least it's been advertised, there's a new topical antifungal that's supposed to be effective for fungal nail infections. In the past, the topicals weren't effective for that because the nails can't absorb it, but now there's a new type out. There's been a commercial out for it, so and that was probably within the last few months that's been advertised for. I'm not sure what the effectiveness of it is because, again, it's relatively new, so it'll be interesting to see if physicians have success using that particular form of antifungal medication for nail infections. Vaginal yeast infections, a lot of times will be treated with an oral type of antifungal. Fluconazole is the type of oral medication they will typically use to treat that. So these are various types of superficial infections involving fungus, and in some cases involving more yeast-based infections. So these are things that I would think by now in your program you've probably gone over. So it's not per se an actual assignment. I'm not going to put a discussion post particular to this, but if you're unsure what these are, make sure that you look them up if you're unsure, or by all means, if you're having great difficulty, you could certainly contact me. But these are typically infections that you should be aware of at this point. And these are just some illustrations of some superficial fungal infections. So you can see the classic, there's the classic ringworm picture in the upper left. You have athlete's foot, which is another version of a fungal infection of the feet. The scalp, again, the scalp and the nails are commonly treated with oral antifungals. Like I said, they have the new topical one. Again, I'm not sure the effectiveness or if people have had success with using it yet. But again, the reason why the topicals were never used with the nails in the past is they can't absorb it. The issue with a lot of the oral antifungals is typically people need to have repeat liver testing done because they are kind of hard on the liver. So usually people will be getting blood work done to make sure that they're not having issues with their liver while they're actually on it. So in as far as the mechanism of antifungal agents, they basically will impair the biosynthesis of the fungal cell membrane, so kind of break that cell membrane down, allowing for the elimination of the fungus. I discussed previously about the potential toxicity to the liver, and a lot of times, or I believe that in most instances, it's called for that liver testing be done if an oral form of an antifungal is to be taken. And again, that's to make sure that the liver is not getting stressed while the person is on it. So ketoconazole is one where there's a high potential for hepatotoxicity or toxicity to the liver. Triconazole will be used in the instance of Tinea corporis infections and vaginal yeast infections. Fluconazole could be used also as well for yeast infections and for Tinea corporis. So, a lot of times it'll be what the physician feels is most effective. Greasofolvin is used for the scalp infections, and the difficulty with the scalp infections is they may need up to 2 months of treatment in order to deal with that, and a lot of times that just has to do with the hair fall. Obviously most people have hair on their scalp, so a lot of times a little longer duration of treatment will be needed for that. So again, just a little bit more on administration, adverse effects. Again, your systemic fungal infections are usually going to be encountered by immunocompromised patients or people that are susceptible to, again, that opportunistic infection. There's a general adverse effect with oral antifungals. Your gastrointestinal irritation would be a common thing to see. There's also the potential for interaction with other meds. So that's why, again, it's important that all medications always get discussed with the prescribing physician so that accommodations can be made for that. And table 9.4 on page 128 in your book, review that because it will give you some brand names and some of the different types of formulations of different types of antifungal medications. Right, antiviral medications, they're not used a whole lot. I would even say in general, they're specifically not used a whole lot with athletes. Your common upper respiratory infections don't respond to these. So your typical colds don't respond to antiviral medications. What antiviral medications are going to be commonly used for are things like influenza, herpes skin infections, chickenpox, and shingles. So those will be what antiviral medications will be used for. So your viral colds, even viruses that cause sinus infections, and even in a lot of instances some issues with the ear with some types of ear infections, they will not use antiviral medications to treat these particular issues. Antiviral drugs work through 3 different mechanisms. So the 3 different ways they work, one way is by inhibiting the viral DNA, so actually breaking down that structure of the virus. They block the protein channel needed for replication, or they inhibit viral encoding. And what this does is it decreases the viral particles that get actually released from the cell. So those are the 3 different mechanisms by which these different antiviral agents will work. So to understand this, you have to kind of have a basic understanding is how viruses operate. Remember, when viruses come in the body, they only really bring DNA or RNA to replicate. So what they basically need to do is, when they get into the body, they need to find a host cell. Okay, so they can't survive on their own. What they need to do is invade a cell in the body, and then basically once that happens, they use the cellular mechanism from the cell they took over to replicate. Okay, and what that does is within the host that the virus has kind of gotten into, it allows for the virus to continually reproduce itself. And it's at that point when the only way the body can overcome the virus is produce enough antibodies to kind of stop the virus from reproducing and working. So that's the basic way. Again, viruses are very particular in that they need that host cell in order to replicate. So some specific antiviral medications, your acyclovir and valacyclovir, those are commonly used in the treatment of herpes simplex infections and also your herpes zoster infections. Herpes zoster, again, is your shingles infection. A lot of your different antiviral medications are used to treat influenza. So think about your influenza symptoms. What do you commonly see? What are considered your flu-like symptoms? And these are some different types of antiviral medications, their brand name and their generic name. The key with these is they need to be initiated within 48 hours of symptoms. The benefit of taking them is that they can reduce the illness by a day to a day and a half, and kind of bring down the symptoms a little bit more, to kind of limit the flu issues. Again, they're not a replacement for flu vaccines. You know, it is recommended by physicians to get regular flu vaccines, but certainly if a person does get an influenza infection, they can be reduced by many of these medications. Various routes of administration for antiviral meds: topical, oral, IV, and even inhaled. Again, the type of infection will determine the route of administration, and usually your IV or your intravenous is not usually utilized in young, healthy individuals. They will usually use another route of administration. Again, probably your more common thing to see there would be your topical in the case of a superficial viral skin infection, or your oral administration in the instance of an individual who gets infected with the flu. So some side effects. Very common to have diarrhea, nausea, vomiting with many of the different types, and I have up here also listed some particulars with certain versions of antiviral medications and what you commonly see. Your oral acyclovir, not uncommon to also get a skin rash. With IV, there's the potential for kidney damage, so those would be things that would have to be monitored. Amantadine, neurological and GI issues, and Romantadine as well will have the potential for both neurological and gastrointestinal issues as well. Zanamivir is very sensitive for people with lung disease, and it could possibly cause bronchospasms. So that's a specific type of side effect associated with that particular medication. Again, review this. This is a different chart in your book on the antiviral medications. Again, it's good to just familiarize yourself with names, and you'll see characteristics. Here's kind of something you could hone in on. Look at the characteristics of the names, and that a lot of times will tip you off to what type of medication it is, whether it's an antibiotic, an antiviral, or a antifungal. So kind of note the names and be able to recognize some of the different types and what they're utilized for.